Hi, it's Jane with Scraptasticyarns, and today with hashtag 50 gone by 2024, we are going to talk a little bit about insulin resistance. But before we get into that, let's do the medical disclaimer. As always, check with your physician or healthcare providers before starting any exercise program, diet program, or following any of the advice that I give here. This information here is my personal research into different health topics, and it is not considered, should be considered as medical advice. That's why you contact your own. Before I get into that, I don't know about you guys, but it's freezing here. It's like 36 degrees, and yeah, it's kind of early in the morning, but man, chilly. But here's what I find funny. I don't think it's supposed to get above 55, 56 today here in Pennsylvania, but then Friday it's going to be in the 70s. I don't know. I don't get it. All right, today we're talking a little bit about insulin resistance. Many of us, as we get older, find that we turn diabetic, type 2 diabetes. But many times it's more of an insulin resistance. So let's talk about what that means. Insulin resistance means that the body is not responding as well to insulin, the insulin made by the body itself, or insulin injected as a treatment for diabetes as well as it should. Someone with insulin resistance may require 2 or 3 more times the amount of insulin to keep blood sugar normal as someone who has normal response to insulin. Precisely what causes insulin resistance has been a major focus of the research in diabetes for the past several decades. They do, however, find that insulin resistance clearly is a result of abdominal obesity. Well, you know, some of us are just blessed. What can I say? Fat cells in and around the internal organs of the abdomen make a variety of chemicals that are associated with insulin resistance. So the greater the abdominal obesity, the greater the waist circumference, the more insulin resistant someone is going to be, and the greater his or her likelihood of having diabetes. So obesity causes insulin resistance. Then the question becomes whether insulin resistance also causes obesity, which leads to a very vicious cycle. To some extent, this is probably the case. One concern here is that insulin is an anabolic hormone, meaning a hormone that produces energy storage, including fat storage. And if you are on insulin, you know once you start insulin, you gain weight without changing anything that you have done in your life. That is just a normal fact of starting insulin. So, when you're taking calories, some of those calories are going to be stored as fat, and insulin is an important part of this process. Thank you so much, insulin. Obviously, if you don't take in the calories, you won't store the fat. So those with insulin resistance can still lose weight if they reduce their calorie intake and increase their calorie expenditure through exercise. There we go. There's that dirty word, E. The weight loss then leads to improved insulin sensitivity, and the problem becomes steadily less severe as someone loses weight. If someone who is insulin resistant has difficulty losing weight despite good dietary and lifestyle habits, metformin may be of help. And metformin is a medication that is used to treat diabetes. However, there's also research at a certain age metformin should not be given. So there you go. Supposedly, these drugs tend to suppress appetite somewhat, and those taking metformin have a fall in blood sugar as well as decline in insulin levels. And sometimes it can help you lose weight. There are also certain insulins that they will give you that can help you lose weight. One of them was Byetta, which actually is made from, I believe, lizard spit or something like that. Who knows? So, you do need to lose weight in order when you have insulin resistance, and that can become a struggle. But there are some tips to help you lose weight and increase your body's sensitivity to insulin again. Of course, the first one is reduce your overall food intake. By reducing it, you will find that that it helps in the weight loss. We all know that. But you got to make sure you're not in starvation mode. They do suggest, as always, that you keep a log of your food that you're eating in a food journal or an online food tracker, so that you'll know how many calories you're consuming currently. Then try to reduce that daily intake by approximately 500 calories per day. If you find that you're eating foods high in sugar, those should be the first ones you decrease or eliminate. Doing that should help you lose at least 1 pound of weight loss per week, which that's a good goal. You know, that's 52 pounds in a year. So, hey. Now, according to the American Dietetic Association, losing just 5 to 10 pounds will actually increase your body's sensitivity to insulin and lower your blood glucose. Eat smaller meals frequently throughout the day. This practice will help you minimize fluctuations in your blood sugar and insulin levels. Also, it helps you feel more satisfied and less hungry. Hunger usually leads to us making really poor food choices. Oh yeah, always. That are typically high in the types of ingredients and nutrients that promote elevated blood sugar and spikes in insulin, which you absolutely do not want. Eat more fiber. Focus on getting 25 to 30 grams per day from various whole grain and vegetable sources. Dietary fiber slows down digestion and may limit increases in blood glucose, which, when chronic, leads to insulin resistance. It also aids in feeling full longer. Stay hydrated. You know, this can't be emphasized enough. Just in general, staying hydrated. One, it's good for your kidneys, and we all need to have great kidney function, you know, unless you already have issues with your kidneys. So, drink more fluid. It helps flush out all the toxins and everything else. And it also helps remove excess sugar. So, you know, that's something to be considered. And of course, increase your physical activity. You want to do a combination of cardiovascular and strength training exercises for at least 30 minutes a day, 3 to 5 days a week, which will lower your blood glucose and help with that sensitivity to insulin. Aim for at least 7 hours of sleep per night. Have you noticed a trend here? Sleep is very important to weight gain and weight loss. So, yeah. A recent study showed that just one night of shortened sleep was enough to induce insulin resistance. If you are chronically sleep deprived, it may contribute to your insulin resistance. So basically, what they find is losing weight helps improve your insulin resistance. It just does. As always, diet, exercise, all those things can help. Some of the other sources that they suggested trying were the DASH eating plan, which it does not focus on calorie control. Instead, it encourages people to eat plenty of fruit and vegetables, low-fat dairy products, nuts and seeds, beans and pulses. The DASH diet is more suitable for long-term application than many calorie-controlled diets. This dietary approach also provides high fiber intake, which helps manage blood sugar levels by slowing the absorption of carbohydrates and reducing the need for insulin. And there are a couple of other diets that they recommend. The Mediterranean diet, a whole food plant-based diet, low carbohydrate diet. A person making changes to their diet, as always, should consult your medical professional. Please always do that beforehand because you never know. They also talked about this that I found rather interesting. One of the things they told you to do. If you are smoking, quit smoking. Some studies have suggested that regular use of tobacco products may increase the risk of diabetes and insulin resistance. Others, however, have not found a direct link. And there's a 2016 study about that looked at nearly 6,000 people and concluded there may not be a direct link between smoking and insulin resistance. However, it is still thought to possibly play a role in causing diabetes in combination with other factors. Oh, isn't that amazing? And of course, smoking is a risk factor for heart disease, lung infections, and other health conditions that are complications of diabetes, which smoking can worsen those. For this reason, a person with insulin resistance or a high risk of diabetes should quit smoking if necessary and avoid secondhand smoke where possible. I found that research a little bit interesting. Here's something else that you may want to consider. Some research has found that people with diabetes are more likely to have a low vitamin D level. Doctors do not check vitamin D levels. Rarely do they check those. They usually wait until you're in a serious situation and they see all the signs and symptoms of a low vitamin D level, like rickets and all kinds of things, and then they'll do the test. So you might want to consider asking your physician to just do a vitamin D, as in dog, test just to see where your levels are. Now, there is some debate about whether certain levels are low. There's certain research that shows some of the levels that labs report are actually lower than they should be, and you should be taking additional vitamin D. So, as always, check with your doctor and talk with that about it. But researchers have found that taking vitamin D supplements do not affect your blood sugar levels in people with well-managed diabetes. The Office of Dietary Supplements recommends that people ages 1 to 70 years consume 600 international units per day. So, you need to consider that. Of course, there's a lot of places you can get that vitamin D. Sunlight is the best concentrated source of vitamin D. Some of the dietary sources include oily fish, fortified milk and other dairy products, fortified cereal, egg yolks. Eat your eggs. Eat them whole. People should talk with their doctor about whether vitamin D supplements are appropriate for them. And of course, we already talked about sleep. Sleep is very important. More and more research indicates that sleep is a big factor in weight loss. So make sure you're getting enough sleep. Medications. Sometimes medications will either improve or they can do something else. They can do the opposite. So make sure that you and your doctor are discussing your medications. When you go in, your doctor wants to give you new medication, ask them what it's for. Ask them what it does. Are there any side effects? And if they won't give you that answer, then talk to the pharmacist about it. Pharmacists are always ready for a consultation, so consider that. And here we go with the takeaway from a lot of this. Diagnosis of insulin resistance does not automatically mean that you have diabetes. However, without intervention, diabetes can develop. Achieving and maintaining the suitable target weight can reduce the risk of developing type 2 diabetes. People with insulin resistance, prediabetes, or diabetes should ask your doctor about a suitable weight loss plan. I'm going to add that with a caveat. Doctors do not get a whole lot of nutrition courses, so many of them don't turn to nutrition to fix the things that are wrong with your body. You're more likely having a better source going to a dietitian, to be honest. Helpful eating habits are crucial for losing weight, maintaining a healthy weight, and also preventing insulin resistance. As always, you want to make sure that you are adjusting your diet when you need to for those kind of things. Pay attention to food order. What is that? While what you eat is incredibly important, it's also about how you eat your food. Several studies suggest that eating protein, vegetables, and fat 15 minutes before carbs can lead to significantly lower post-meal glucose and insulin levels. So those findings show that the order in which you eat your food matters and can play an important role in effectively controlling that post-meal glucose. Post-meal glucose is what happens after you eat, generally within the first 4 to 2 hours. It's also called a postprandial. Your glucose level will shoot up, and then after that 2 hours it should come back to a normal level, give or take. Now this is something I found interesting. They suggested including apple cider vinegar. This is one of the studies. One simple and inexpensive way to improve insulin sensitivity is to consume apple cider vinegar with your meals. A meta-analysis of 6 studies involving patients with type 2 diabetes concluded that consuming apple cider vinegar produces beneficial effects on blood sugar. While it's not a miracle solution, there's enough research to warrant some personal experimentation. So try it for yourself. Mix 1 teaspoon of apple cider vinegar in a glass of water and drink it with each meal. I'll be honest, I don't know if I can do that. Exercise after meals. Research shows that walking 40 minutes soon after a meal can prevent glucose spikes. Your muscle cells use more energy when moving, which causes them to absorb more sugar from your bloodstream, which prevents blood sugar spikes. We don't expect anybody to walk 40 minutes after every meal, but we encourage you to do that several times per week and whenever you feel up to it. Even taking a 15-minute post-meal walk will offer some blood sugar benefits. Start where you are and increase your time as you can. You'll be surprised about how good you feel afterwards. You never know. Another suggestion was to lift weights. Adding resistance training to your routine can amplify your insulin sensitivity. One study on overweight men, I find that interesting, found that resistance training over a 3-month period increased insulin sensitivity independent of other factors like weight loss. It also found that it increased muscle mass, which is linked to better insulin sensitivity. Muscle mass is one of the biggest indicators of metabolic health and weight control. Start low and increase those weights you lift over time. Aim for at least 2 weightlifting sessions per week. And then again, we come back to sleep. Get more sleep. One other suggestion that they talked about doing with your sleep is catch up on your sleep. There are some other steps they call sleep hygiene by going to bed at the same time each night, reducing blue light exposure in the evening, avoiding caffeine after 2 p.m., making your bedroom as dark and as quiet as possible. That blue light also includes your phone and your electronic devices. So there's that. One of the other suggestions, if you have insulin resistance, is to consider using a continuous glucose monitor. These are small wearable sensors used to measure the glucose in your body. They'll give you instant feedback on which foods and lifestyle habits are best for your health goals. In terms of weight loss, they'll also help you see exactly which foods trigger insulin and fat storage in your body in real time, allowing you to tailor your diet with precision. So here we go. If you're struggling, think about using some of those tips. They can help you. There is another suggestion that they talk about with insulin resistance, and that's intermittent fasting. We've talked about that in the past. Intermittent fasting has been proven to initiate the repair of important cells in the body and balance hormone levels, which facilitates fat burning. On a broader scale, intermittent fasting also has significant effect on your metabolic health and the body's insulin levels. So why is that? Insulin is the main driver of fat storage. If you're constantly eating, you're triggering insulin production all day long. When people have too much insulin, their cells start to resist the insulin, and in response, the body has to make more. So some of those strategies you want to find are to decrease the amount of insulin that your body makes so you can improve your insulin resistance. Fasting for at least 16 hours gives the body a chance to rest and allows blood levels of insulin to drop significantly. Not only does this help burn fat, it can also lower your risk of disease in diabetes and prediabetes. It also has a range of metabolic benefits. Not only are you going to see improved insulin control, you're also going to see a decreased inflammation, in pain, gut health, and overall health, even without significant weight loss. So there is something to be said about that. It also helps people with strong responses to insulin and hormone irregularity, like those with polycystic ovary syndrome. It can help people with PCOS, which is the polycystic ovary syndrome, control their insulin levels, balance their hormones, and therefore improve their health and the symptoms of their disease. So there you have it. Today's topic, insulin resistance. If some of these suggestions aren't right for you, as always, you need to talk with your healthcare providers about them. And, if not, and they give you the okay, try some of those things, go for it. You never know what will help with you. One of the things that I've found with reading some of the different studies is if you have a larger gut area than the rest of your body, most likely you already have insulin resistance. Those two go hand in hand. So those might be some suggestions, that you might consider using. Alright guys, that's it for today. I'll see you again soon. Be kind to one another, love one another, and as always, get out there and see this big, beautiful world we live in. Alright, see you guys later. Bye.